There is a patient who pays the insurer, also the dark lines, or pays the provider directly. Third party payer, insurance company pays the. And service provision is only between the provider and the consumer. All these relationships in the other sectors are okay. In the healthcare sector, we have problems of information asymmetry, moral hazard, high transaction cost, all those apply. So how do we manage a healthcare system? What do good healthcare systems do? What do bad healthcare systems do? The bad healthcare systems do is don't intervene in this sector very much. They think, because they think that this is, governments cannot improve the situation, just leave it. If the government is to improve the situation, the suggestion is spend more money. The government should just give the money so that people who can't afford it. In healthcare sector, it's very easy to pour money down the drain. No matter how much money the government provides, providers will find a way to take it out in the system. So, because there is no, these patients actually really don't care what happens to the national economy, because if the government or the insurer pays the provider directly. So in fact, the happiest situation is for them when the patients get every service they want in the best quality, and the provider is very happy to provide it. Right? And they both send the bill to the government or the insurer. It's fabulous. Who suffers? The national economy, the government budget. Because, so patients and doctors collude to rip off the society and the government. And how do you end up with 19% of GDP spent on healthcare, as is the case in America? Well, you have the answer. 70% of the patients in America say they love their healthcare system. Most of the doctors say they love the healthcare system. If only the government gave them more money and had less control. It's beautiful, right? Give more money, less control. Well, the Chinese tried that. They didn't give more money, but they had less control. But I would argue that to get an effective system, what you need is a very complex system of incentives and controls. So incentive to improve the market-like features in a system, and controls to improve the government-like features. In other words, you need both more market and more government. So I'm not suggesting that the condition they had in the 1960s was the best possible situation they could have had. They could have improved it because there were many problems in the 1980s systems. It could have been improved by more incentives. But those incentives did not mean you just remove all the controls. In fact, you needed clever controls, more controls. So, so I'm arguing for smartness, not more. So you can have more smart controls. I will not get into this, and it will be available to you. I will send it. But I'll just take the essence of it. So what does an effective healthcare system require, in my view? In my view, they have expected that it requires a lot of incentives and controls on providers. Providers are the hospitals, the doctors. You have to give them incentives. What incentives do you give them? Give them incentives to contain cost. Right now, the system that they both had in the night, the incentive was to increase their income. Remember, the governments were being encouraged them to get their own money, earn their own money. So the other way around, give them incentive to save money. It's more difficult, but can be done. To improve quality, give them improvement. In a public hospital, I wasn't there, from what I know, in the 1970s, in China, it was not a happy hospital to go to. But people lived very long. People lived very long. They got the essential care very well, but it was a very unfriendly, poor quality healthcare. So you can make that. There are enough incentives that you can build in systems to make these hospitals be more customer focused, more patient focused, and so we don't need to remove the controls to make them full. And also, to maintain access, you have to do something to make sure that these providers look after the poor. Because if you don't look after the poor, the rich have always been able to look after themselves. Healthcare policy is not about looking after the rich. They can, if you don't give them here, they will fly to New York and get it at the Mayo Clinic. They don't have to get it here. So the government's responsibility is really for the people who cannot get on the plane and go somewhere else to get the healthcare. They can fly in the doctor here, right? If you have the money, healthcare is not a problem.
Can you specify a little bit more about continuing costs? How can you make people safe in this
System provides, yes, what they call a cap payment, capitation payment, which Alexa now has. You pay, say, $100 to a doctor for each patient on their books. So they have a clear incentive to spend as little as possible. And in a fee-for-service payment, the more service you provide, the more you can bill them. In that cap payment system, the payment has been in advance. So they pay them now, so 100. So Kazakhstan now and Amazon and many other countries, the provider gets only a fixed amount of money each by patient. So they have a lot of incentives to make sure that you don't fall sick. So they vaccinate you. They give you advice that you're overweight. Please run, please walk, please eat less. Because if you fall sick, you'll end up in the hospital. So it's giving an incentive. If they come to the hospital, they are told that it's okay, headache is not the most abnormal thing in the world. Just go and relax at home and take a bath or something. But if you are fee-for-service payment, you just provide them. So that give them an incentive, because if they get $100 and they cannot spend $110, right? They get $100. But if they can only spend $1 on you, they can keep 99. If they're spending 50, they can keep 50. So it's the difference. So it's a very clever way of doing it, right? The problem, as you can guess, is that they're too clever. Providers are medical doctors are no different from professors, and professors are no different from businessmen. We all know economic incentive. Lead us in one direction, we'll lead in that direction. So here the incentive becomes provide as little as possible. If you go with a headache in a fee-for-service payment, they will sell you for 200 scans because they can charge you for all the 200. In a cap payment, you can go every day and say that I have a headache, I'm suffering. They will say, it's okay. Just relax, you are stressed at work. Why? Because if they give you any service, it's less profit for them. So it's very, very important to keep that. So this is why you need controls. Because if you just give them incentives, because of the information asymmetric problems, agents are very successful in working the system in their behalf, for themselves. So you need controls. Limit providers' ability to exploit you. They exploit the patient because you don't know. So you put controls on them. So some of the controls are that they make you sign, you get your medical degree, you have to sign that you engage in ethical behavior, and if I'm found to be unethical, I can be deregistered. This actually works, especially people who are hopefully ethical to start with. But you can go more further, right? You can check their bills. If somebody, because a lot of health ministries have quite a large bureaucracy checking bills. So if somebody had a headache, a brain tumor, and they see an orthopedic surgery, they know that somebody is treating it. Right? So you need very strict controls over them. You can't just leave it to the market, because an average patient cannot tell that a brain surgery doesn't require work on the knees, because we use all these medical terms. So that's why you need a lot of controls. The system doesn't work on its own. A government has to monitor costs. It has to monitor utilization. The way it does not do for shirts or haircuts or massage, it really doesn't matter. Because since the amount is so large and it touches on the fundamentals of, it has to keep track, very detailed information. And here, keep in mind, if it's a private system, government doesn't have much information. one of the best things about a government-provided healthcare is that the government has real-time information if it is maintaining that information. In a private market, why would a private provider keep accurate information for the use of the government? Government can require it, but it requires more tighter control. Also, it's very important, how do you get tertiary care? Who goes to hospital? How do you go to hospital? If I have a headache, the tendency is to think that I have the worst possible. I want the best healthcare. What does the best healthcare mean? Go to the hospital, the biggest hospital, right? Who goes to the biggest? How do you get into the biggest hospital? Very hard. Because if everybody wants to go to the biggest hospital, there'll be a big line. Jump the queue. How do you jump the queue? But if your uncle is a minister, perhaps you have a lot of money. So even in a free healthcare, it's not free when you have to pay. Bribe. So a lot of healthcare systems, that's why. Because why do they have to pay bribes? Because they can't get into the hospital they want to get into. While on the other hand, there will be a lot of doctors sitting there with no patients. So government has to make sure that you do not go to the hospital in the first place. They have a referral system. Does the referral system work? No, it won't work. Why won't it work? It won't work if you give the hospitals the incentive to make money. If they tell a patient that you cannot come here because you don't have a referral, they lose money. Will they do that? No. Whether you have a referral or not, they have every incentive to look after you. In fact, they're competing with the primary care provider. Each patient who goes to a primary provider is one less for the hospital. So you have basically turned the incentive around. So we need very strict gatekeeping that we will not pay you 1 cent unless you have a referral from a lower level hospital. So in Singapore, if I want to go to which by the way is a very tightly controlled system. If I go to a hospital directly, I have to pay 100% of the cost. If I want my insurer to pay, I need a very strict referral from my primary care provider, GP, general practitioner.
And so it's quite difficult to get, right?
What's that?
It's quite difficult to get the insurer from the primary, right?
Why should it be difficult? You're sick?
Yeah, well, only in the case of the sick, right?
Yeah, that's right. So whole idea is that only the sick people go to hospital. Because if we look from the hospital's point of view, they like people who are not sick. The more non-sick people come, the more money they can charge you, because you already have proven to be a paranoid person, a hypochondriac. You are proven hypochondriac, so you're just prime target for a hospital. Please come every day. We have a lot of tests for you. And you don't mind it because you're probably getting a medical certificate to be absent from work, right? Very easy. Because they have to make money, and this is the least they can do is to give you a certificate that you're sick. And everybody else is happy because they will send the bill to the insurer. The thing is, but if the insurer says no, we will not pay. This hospital will say, sorry, we can't provide you with the service. The patient has to go back to the primary care. So in a way it's very easy, but then you are fundamentally attacking the system by telling the hospital you cannot make money. In a free market you can't do that, right? You're supposed to make as much money as you can. Which in a department store doesn't work, because a department store may want to make as much money as me from possible, I just won't pay. Here it doesn't work. Anyway, so what's the reality? Running behind time? And quickly. So in reality in China and India, there's really none of these conditions were there. Private providers could make as much money as they wanted without any fear. There were some rules here and there, but nobody bothered enforcing them. In China, it's the same Communist Party that was running the hospital and the government. It was just a free market heading. You can pass on the cost. Whatever your incompetencies or inefficiency, you can bill the patients. Why would you worry about it? There were so there were bad incentives, weak controls. So now you have to control the users too, because because just for controlling providers is not enough. So you have to give them incentive to behave properly, and you have to control them as well. Some of the things you can do is, they should be looking for cost-effective treatment and not vanity treatment, the one that they like, the one that they enjoy, or the one that they need. They should be discouraging access to unnecessary care, especially advanced care. Advanced care, the diagnosis is very expensive. It should be stopped. Giving not just control, but incentive not to go there. You have to need controls that you must pay a part of your bill. Right? If you are required to pay a part of your bill, so if a bill is $100 and you're required to pay $20, well, you think about it. I enjoy my doctor. I like to sit around the doctor's clinic, especially if I don't alternative is to going to work. I won't go to work. I'd rather go to the hospital and sit around all day and get a medical certificate at the end of the day. Stop them from going there. Stop them. So this is the users. None of these things were applied. In this country, the poor people, both in China and India, were not going to the doctors anyway. So they were totally outside the government incentive or government control. Because this system works only if you have money. No money. As far as the health policy is concerned, don't exist. And those who did have money, they would run straight to the hospital. Primary care providers will be sitting around with not enough job, not enough work, not enough income, because people are all in the hospital. And hospitals like it that way, both China and India. I just told you that cost sharing is good. If you are required to pay $20, then you will think about it. How about 100 out of $100? That's what they were doing. There was no government. You're paying the full charge. In other words, this control is too controlling. It just shuts out the poor people in the rich people. And for rich people, 100 out of 100 is not a big amount of money. But for middle class and the poor people, it's a lot of money. So you end up with the worst possible system, where you have no control over the rich users, and you have completely shut out the poor. So you actually, when you think about it, you cannot have a worse healthcare system than this. You end up with what looks like a very simple application of an economic theory, creates this monstrous system as far as the users are concerned, which has no effect on the rich and an extreme effect on the poor. So third party, this is the insurer. What do you want? You want an insurer who negotiates with the provider, right? Give them an incentive to reduce the price. Because if they can pass on the extra cost to the population in the form of a higher premium, then it's very undesirable, because then the sky is the limit. What has happened in the US? People in many countries, people demand more services. Hospitals are very happy to give you the services. Send the bill to the insurer. Insurer increases your premium. What you want is an insurer to say no. We will not pay this bill. How do they do? They negotiate with the provider. Like, why are you providing so much service? Or they can require them to bundle services. Not every hospital needs every clinical specialty. Because remember, insurer is a buyer on your behalf. They have a lot of bargaining power, which they don't like to use because life is comfortable. But if you force them to, or give them an incentive to bargain on your behalf, they can, because and Japan is often cited as an example of a country where the insurer is the main driver of the system. They use a very active buyers to keep both the providers and in check. Cream skimming. Well, you know what a cream skimming is? You get the cream out of the milk. Hospitals are master cream skimmers. They want healthy patients, and they dump with sick patients. If you are a sick patient, they ask you to go somewhere else. And if you're a sick patient with a lot of money, please go to If you have a sick patient and don't have money, go to the next one. Called dumping. So in the US, all the private hospitals are looking always clean screening. They want the good patients. The good patients are ones that are not very sick or are very well insured. If you're bad, you go to the public hospital. And so that's why public hospitals end up with a lot of sick people who don't have insurance. And then the same people say, oh, the service quality in public hospitals is very, very bad. It's a big lineup. You know, how do you end up with a lineup? Because they have been dumped patients. They have dumped the patients on these hospitals. So in other countries, there was no social insurance system. So it really didn't matter. The third-party payment, third-party controls did not exist because there wasn't an insurance system. And this is another thing. When governments spend money, it gives them control, right? If you don't spend money, no control. I have no control over a department store where I don't go. I have control only if I go and buy a lot of things, and I can threaten that I won't come to your department, so they will listen to me. This is what is happening to the government. Government provided them with, and doesn't pay them money, so they say, who cares if we don't like what we are doing? You know, in fact, they're paying for so little. Why don't you? In fact, in China, the medical association actually wrote to the government saying, please stop us paying us any money. Please do not pay us any money. Because you pay us a little bit of money and you tell us to do so many, you put so many restrictions on us. So keep your money, keep your restrictions. We can look after ourselves. So this is what was happening in both countries. The government was spending so little, less and less and less. Government had very little control and less and less. And by the way, if you smile, we're describing Kazakhstan here too. We're not just describing China in the 1990s. Okay, so, I will end over here. And this is a very unfortunate saga in our policy thinking, that anything but the government is a good thing. We should look for solutions in the market, networks, voluntary organizations, families. We should do everything. Just don't ask the government to do it. And that's very good. And sentiment I actually share. I'm not particularly fond of governments either. But I do care about good public policy. And if something we know that only causes damage, why would we do it? And that's exactly what we were doing. The question is, why were they doing it? And that's a separate paper, but the clue is in the self-interest. These doctors are elites. They are members of the elite society. They have a lot more power. And another thing is the economic thinking. Too many people have learned economics. In your next semester, you will have a professor. He's an economist, very good economist, Mukulasha. He will tell you half knowledge is very dangerous. Too many economists are working on the sector, and they have only half knowledge of the sector. So they do a lot of damage. Professor Mukulasha will correct many of your. Do take his words very seriously, because he is as good as it gets in, a realistic economist who understands the subtleties of different sectors. I think he's coming in January, right? Or is it in March? Yeah, something like that. And you will see. Anyway, so we'll just start with. Yeah, 10 minutes, 15 minutes.
Yeah, questions, comments, follow-up?
Yeah, I have a small question. Why do you say that Kazakhstan is experiencing the same problems currently? Because most hospitals, big tertiary hospitals, are public here. Well, they do have patients who want to jump the line, they pay. And but if you need to go, if you are sick, you end up actually in tertiary hospital because there's a system of referrals, right? That you go to the small clinics and then they refer you, you're sick, and then they assign you a paper and then you go to.
We are talking about the 1990s.
Okay, what happened there?
Yeah, so that was when the government, and even then they had it was for a very short period of time. So government of Kazakhstan did not succeed in thoroughly dismantling the system. Unlike the Chinese government is a more effective government, so they succeed in doing bad things just as well. They succeed in good things. So if they wanted to dismantle something, they dismantled it so thoroughly and so quickly, which most of governments will take a long time. So yeah, so in Kazakhstan, the reverse course much earlier.
So how do you assess the system now?
Yeah. So actually the current system is not very different from many other reform systems. They did learn. They did learn. many of the problems have been addressed. At least they're trying, they know the problem and they're trying to address it. So what I said, if you told them 10 years ago, they'll be scandalized. That that you were a liar, you were just a state-loving, communist central planner. You hate market, but now they realize that markets have limitations. We have to work around them. So that's not me what I'm saying. What they don't have is a way of doing it, because it's the last point on about the political power of the healthcare complex. These doctors, the pharmaceutical companies, the hospitals, the nurses, they all get together and they form a very powerful group, which is even more powerful because patients usually like them. Population loves their doctors, trusts the doctors a lot more than they trust the government. Let's put it this way. So governments are very powerless when it comes to dealing with the medical complex.